thought of you that the previous speaker, the OB/GYN doctor, spoke about physical exam, running out of topic, his feeling that the exams were not enough, and also that occasionally these exams done on a rural site while the doctor was down here have been done by perhaps a CNA or some other person with a low level of medical training. It just doesn't sound like what you're referring to as good solid medicine. Now, we're doctors, and the hallmark of medicine, the basis, is a history and physical exam. And I have CMAs in my office, I have RNs. They don't do the physical exam before I dictate treatment to a patient. Now, you've implored us, physician to physician. We just had one that brought up some very serious comments about the very basis of medicine, which is the history and physical exam. It's not being done by a doctor, and it's not standard of care. So I appreciate your passion, but we all went to medical school. History and physical is the purview of a physician. And we have CMAs doing those. I appreciate your thoughts.
First and foremost, all of the comments about the delivery of the protocols underestimates who was involved in the process of developing those protocols. These protocols were developed.
I'm not asking about protocols. I'm asking about who does history and physical, which involves a history and laying on of hands. All of us that have worked in medicine have seen unexpected ectopics. That's a big fear. It's not that common, but it's a disaster. Our colleague from OB/GYN has talked about standards, and that's what we're charged with up here, standards. I don't want a CMA doing a history and physical. He or she may be the best person to look. They're not trained. And the people here have admitted that that occasionally happens. If it happens once, it's not standard of care. Now, I want you to comment on the history and physical, if you would.
The protocols were developed with the input and expertise of national organizations, including the American College of OB/GYN. This person just commented that he could diagnose a pregnancy at 6 weeks by a physical exam. I defy any other obstetrician to make that statement.
Well, but the problem right now is I'm talking about a CMA doing a history and physical. You're kind of going around it, and doctor to doctor, do you have CMAs doing histories and physicals in your particular clinical work? I do not. You're a neonatologist, I'm a geriatrician. That's a sacred part of medicine, a history and a physical. That's sacred. And if it's not being done, that really worries me a lot.
Of course it's being done.
But by
It
the
is
CMA,
ultimately reviewed by the physician responsible for the patient care.
the physical, though, being reported to the physician by a CMA. Please, have you ever, in your neonatology practice, had a CMA do a history and physical on a neonate that you're proposing some medication to? If you can answer me yes or no, I'd appreciate it.
Advanced practice nurses should.
No, CMA. Have you had a CMA do a history and physical on a neonate, and you have relied on his or her input to prescribe your therapy remotely? Yes or no, doctor?
Have I personally?
Have you?
This isn't about my
No,
practice.
this is about the basis of medicine, a history and physical. It's the bedrock that we all depend upon before we prescribe treatment. Have you in your work ever had a CMA report to you a history and physical, and then you, without putting your hands on the patient, prescribed an intervention?
So
Yes or no?
are you taking issue with the development of the protocols?
I'm asking you a question, doctor. Have you ever had, or do you recommend, a certified medical assistant doing a history and physical, reporting to a doctor his or her findings with that level of training and medication or any procedure being prescribed? I defy you to say that you've ever done that. I've never done that, and I'll bet you a year's salary no doctor up here has ever done that.
And I would remind you that this is supposed to be a discussion of the difference between telemedicine abortion and in-person abortion.
No, this is a document. We are focused on this particular interaction between patients and the healthcare system.
And your question of me and my response to that question is irrelevant to this issue.
So I will write down here that you refuse to answer.
Fine.
Okay.
I'll write down that you're harassing him.
Well, I'm not harassing, I'm asking you a question.
And your question is irrelevant
Do
to
you
this
feel-
discussion.
Do you feel it's reasonable to rely on a history and physical from a CMA, Certified Medical Assistant, which the colleagues from Planned Parenthood had said, yes, it may be a CMA? I'm just asking, yes or no?
4:35, let's continue in the hallway. Can we get on with the discussion of this debate?
CMA, history, physical, it's not.
Well, you already have your opinion. Why do you need mine?
You're proposing to us. We want your opinion.